Welcome to our video about movement and setting up some type of exercise or activity routine. This is very important for keeping weight off. One misconception about exercise is that it is really necessary for weight loss, and it absolutely is very, very important in weight loss. But where it actually shines is in prevention of weight regain. And I would say that that is almost just as important as the weight loss itself, because after you've gone to all this work to lose weight, you want to make sure you keep it off. So, whatever type of exercise you choose is always going to be the best exercise. But planned exercise is what is research backed. If the idea of having a planned, structured exercise routine just fills you with anxiety, please don't do that. Make sure you're doing what you feel comfortable with. If just getting more activity in your day is where you're at and that's what you feel is sustainable, that's what you should go with. We talk about planned exercise being research backed. What that means is when they look at people who have lost significant amounts of weight and kept it off for 5, 10, 15 years, what they find is that all of these people had in common planned intentional exercise, oftentimes an hour a day. I know that sounds like a lot. So what we recommend is just doing the best you can. An hour a day does not have to be intense, going for a run, pumping iron at the gym. There are many ways to set up a sustainable exercise routine. Personally, what we recommend is 3 days a week of at least 30 minutes of weight bearing exercise. So this would be resistance training using weights, bands, body weight, something you're doing to build muscular strength and endurance. And then about 150 minutes a week of gentle exercise, going for a walk, going for a swim, playing Pokemon Go around the neighborhood, something gentle, yoga, anything like that. Those all count towards it. So more kind of fun, gentle exercises, and then something to do to build muscular endurance. And that's a key piece, because the more you can build your muscles up, then the higher your metabolism is going to be. There's very few things you can do to truly change your metabolism. So you might read people say, oh, metabolism boosting this, and oh, metabolism boosting foods. There's really nothing that is a metabolism boosting food. There are healthy foods that are going to nourish your body. There is your gut microbiome, which does influence your metabolism. And then there is your just resting metabolic rate, and that is mostly determined by genetics, previous weight loss attempts, so histories of yo-yo dieting, and your muscular level. So how much muscle you have at rest, how much is it burning? Gut health, we can change, and muscles, we can change. We can't change a history of yo-yo dieting or the genetics you were born with, but these are things we can control. So 3 days a week, some type of muscular endurance, and then at least 150 minutes a week. So that should be, 20 to 30 minutes a day, or, a few longer hikes or yoga classes or things of more gentle, just daily movement exercises. So those are some suggestions. Try to keep it measurable if you can. Some people have a lot of fun with pedometers and Fitbits and things. You got to do you. If you like that, awesome. If you don't like it, that's fine too. I personally don't choose to use tracks like pedometers and things like that. I would prefer to just kind of enjoy what I'm doing. But a lot of people really love that. It's really motivating and fun, and you need to do what's best for yourself, because at the end of the day, it needs to be sustainable, something you can do long term. Make sure you've got this in place right now, that it's working towards becoming a habit. Start small. If you have not exercised before, I would not immediately run out and start lifting weights at the gym. Be really gentle on yourself. If you haven't done this before, or it's been a long time, break your way in. Don't go all out and kill yourself and then get super sore and wish that you had never started. And then the other thing to note about exercise is that oftentimes, especially with women too, when we start exercise, men as well, but for women, it's a little more sensitive to it. We put on water weight when we start. And what that is a swelling of water retention in our cells. So this is not weight gain. It's not putting on, you haven't put on all this muscle overnight. So sometimes when we start exercising and lifting weights, that first month, you're going to see the scale actually go up a little bit, which can be super alarming when you're trying to lose weight. Or people think, oh, I've put on all this muscle. You know, physiologically, you probably have not put on all this muscle. That's not really, it's not really something we find. So it's generally just gentle water swelling. It will go away over time. And you need, just kind of like nutrition, to be really consistent over time. So that first month, that's just your body getting used to exercise. And then the second month, that's really where you're going to see strength gains. You might start seeing a little bit of difference in your body. And then after 8 weeks, that's when you can really start seeing a lot more changes. But that's 2 full months of working consistently. So just keep that in mind, is that exercise is not kind of a one and done. It's a gentle long game we're playing. And rest is always just as important as exercise. So make sure that you are taking at least 2 rest days a week where you are not lifting weights, you're not going hard, you're just taking it easy, going for a walk, doing something gentle, because rest plays a huge role in how much progress you're going to make with your exercise. So find something you like, make it sustainable, and go enjoy some gentle movement today.